Assalamu alaikum, the clinical day. We have Mr. John Michael, 50 years with complaint of headache. His vitals, blood pressure 150 over 95, heart rate 95, the temperature is 36.6. Are you ready, Dr. Sarah?
Okay.
Here you go.
Hello, my name is Dr. Mahmoud. I'm one of the doctors here in the clinic. Am I talking to Mr. John Michael, 50 years old?
Yes, I am.
Okay. Nice to meet you today. I'm here to discuss about your health condition. I might ask you some questions and then I will examine you, and at the end I will address all your concern and answer your question. Is that okay with you?
Yes.
Yes, okay. I can see from your notes that you are coming complaining of headache. Is that right?
Yes, doctor.
Okay, can you tell me more about that?
Actually, doctor, I have this headache since long time, almost 1 year now. And I went to my GP many times to understand what's ongoing, doctor. But he couldn't help me. That's why he referred me to you.
I'm really sorry about that, and it quite be distressing for you having this headache for 1 year. But I want to assure you that we'll get the bottom of this. So you tell me you have this headache for 1 year, and this headache has started suddenly or gradually?
Actually started gradually, and I notice day after day, the headache worse more and more.
Oh, more and more. And can you describe for me this headache more?
Yeah, it's dull aching mainly in front of my head, doctor. You know, this area. I feel it in the middle and in front.
Okay. And do you notice that anything make it worse, anything make it better?
Yeah, sometimes when I lean forward, I feel this headache worse.
Is this headache is
Yeah.
worse? Is leaning forward? And is it worsening when you cough or sneeze?
Yeah. Yes, doctor.
Okay. And can you score this headache for me? 0 is no pain and 10 is the worst headache that you have ever had.
Yeah, almost 6 to 7.
6 to 7. And you told me this headache, it's worsening with lying forward and also with coughing.
Yeah, when I bend forward, yes.
And have you noticed that this headache is more in the morning?
Yeah, I noticed that also.
So it's more in the morning, okay. And what is relieve this headache?
Sometimes doctor painkiller helps, but not that much.
And how frequent you are using the painkillers?
It's occasionally, only when I have this headache.
What do you mean by occasionally?
I mean, whenever I have the severity of the headache more, I will take the painkiller.
So
but I'm not regularly taking.
Not on daily basis?
No.
Okay. And you are taking only paracetamol and you notice that it's helped with this headache?
Sometimes, doctor.
Okay. And just to ask you some free question, yes or no, if you don't mind.
Mm-hmm.
Do you have any vomiting or feeling sick while having this headache?
I feel sick, but I didn't vomit before or I didn't throw up.
No vomiting, okay. And have you noticed any change in your vision?
Yeah, doctor, sometimes I notice that I am bumping into the object.
So you notice that you are bumping into the object, okay. And since when you notice that?
Like that, the last 1 month.
The last 1 month, okay. And have you noticed also any blurry vision?
No, doctor.
Any tearing or pain in your eyes?
No.
Any fever?
No.
Any recent history of flu symptoms?
No.
Okay, and have you noticed any change in your swallowing?
No.
Any change in your hearing?
No.
Okay. Any weakness in your body?
No weakness.
Okay, and any shortness of breath?
Yeah, sometimes at night I can awake at night and like gasping for air, then I can sleep again.
So you think that gasping for air, and have you noticed changes in the number of pillows while sleeping? It's make you feel more comfortable.
No, but I notice that when I sleep sitting, I feel comfortable more.
So you feel sitting. And with this shortness of breath, you notice also you have cough.
No, doctor, but my wife told me that I'm snoring.
Okay, no, early in the morning, in your morning.
Yes, you're right, doctor. I feel that I couldn't sleep well and I am sleepy all the day.
Okay, and have you noticed? Just to ask you some other question, have you noticed any a change in your weight recently?
Weight, yes, I put weight, doctor.
So you put weight, and this is was intention.
No, doctor.
Okay, and have you noticed any change in your size of the shoes or your size of your clothes?
Yes, doctor. The shoes now change always tied to my foot.
Tight. Okay. Any swelling in your foot?
No, but I feel it's like tight, too much tight.
Okay. Did anyone told you that there is changes in your facial, in your face character or in your picture?
Yes, my wife told me the same. She's telling me I'm snoring, and also she's telling what happened to your face, why it's like that. It's like too much bigger than before.
Have you noticed any feeling tingling or numbness in your hands?
Yes, I feel, doctor, in my hands and mainly in the three fingers,
Three fingers. Which three fingers?
the thumb and the next two fingers.
Okay. Okay. So I will examine you. Don't need to worry about that.
Mhm.
And did you notice any even heart racing?
Yeah, sometimes I feel this feeling.
Heart racing.
Hmm.
You feel this heart racing at rest
No, with the effort only.
with effort, and this is new things that you're feeling it.
Hmm.
And what do you mean by effort? How much exertion you are doing to feel this heart racing, or this is normally with minimal exertion?
It's when I'm climbing stairs, going up, and yeah, mainly with this severe exercise or too much activity.
Okay. And what about your bowel habits? Any change in your bowel habits?
Yes, it's more hard now.
Small heart. Have you noticed any blood or black stool
Yeah, I noticed as well some black stool and in the last week.
the last week? Okay. And when you had this headache, you told me that you went to the GP, and did he do for you any investigations or give you any
No,
apart from the paracetamol?
he said it might be migraine and he gave me some medication, but it couldn't help.
Couldn't help. Okay. And just want to ask you also some questions. Do you have any medical condition I should be aware of?
Yeah, recently, doctor, I was diagnosed with the hypertension.
Hmm? And you are
Yeah.
taking medication for it?
I am taking amlodipine, but it's still not helping.
So it means that your blood pressure is not controlled on amlodipine, right?
Yeah,
Are you taking any other medication apart from the amlodipine?
only amlodipine, and the GPs increased the dose to 10
Hmm?
the last month, but I think still I have this high
Oh,
blood pressure really.
okay. And have you noticed any skin rash or any skin tag in your body, tags in your body?
Yes, doctor, I feel in the back,
What do you
some,
mean by yes?
in my shoulder, in the back of my shoulder, there's some darkening.
Darkening in your shoulder, on your skin,
Mhm.
you mean, of your back?
Yeah, the skin of the shoulder, back of the shoulder, yes.
Of shoulder, only darkness, it's mean, right?
Yes.
And no skin tags?
Yeah, also in my hands, I feel the skin tags.
Okay. And just to ask you also, and okay, have you noticed any secretions coming from your breast, white secretions?
No, no.
No. Okay. So, and what I just want to ask you, what do you do for living?
I'm taxi driver, doctor.
Okay, so I advise you to wait because you're saying that you are dumping in the wall. Uh,
Hmm.
so it's better to hold your driving till we'll get the bottom of this.
Okay.
Okay. And just some question regarding your lifestyle. Do you smoke?
No,
And what about alcohol?
socially only at the weekend.
Socially. And who do you live with?
My partner.
And this is your stable partner?
Yes.
Okay. For how long you are together?
Long time, doctor.
Long time. Okay. Any casual relationship?
No, never.
Any recent history of travel?
No.
Okay. And I just want to ask you, is anyone of your family has the same condition or has
Yeah,
medical condition? Yes. What?
my father was having gland problem and some cancer in the last days of his life.
And you know exactly which kind of gland he had?
No, doctor, I can't remember the name.
Okay. And which type of cancer he is having?
I guess in the brain or something like that, doctor.
And how is he doing now?
No, he died, doctor,
I'm
in his 70s.
I'm really sorry about that. Okay. And okay. So I would like to examine you and I might ask you some question.
Yes, so
Have you noticed have you noticed any pain in your face or the muscle in your face?
no,
Okay. Any discharge from your nose?
no.
Okay. So first I will examine you. I need to check the vitals.
Mm-hmm.
And
As they say, others in the card, 150 over 95.
the blood pressure is a little bit high. Okay.
Mm-hmm.
I need to check the blood pressure standing and sitting.
No change.
No change. So first, I would like to examine the head for any neck rigidity or photophobia.
No.
No, okay. And then I will do the visual field
Yeah, I mean, you have bitemporal hemianopia.
by temporal hemianopia, and I need also to check for any nystagmus,
No.
eye movement, and the visual acuity.
Okay, you can see.
You can see. Okay, and now I would like to also do ophthalmoscopy.
Yes, skip.
Skip. Okay, and I would like to check the muscle in or the power of the muscle of the face and the sensation.
No, normal muscle power and sensation. What
Okay.
else you want to examine the face?
Muscle of the face, power, sensation, and the hearing.
Nothing, it's okay. He can hear well.
Okay. So and I would like to examine the neck for thyroid gland or lymph nodes.
No thyroid in the middle. I mean, nothing in the middle, but at the lateral side, there is some swelling
In the neck.
in the neck.
You mean lymph nodes or what?
Not lymph node, at the lateral side of the thyroid.
That will of thyroid. Okay. And have you noticed that you are become more you become more thirsty or
Yes, doctor, I noticed that it's too much annoying me, and I always drink water.
always drink cold water? And okay. And what about your mood?
Yeah, it's not that much. I feel low, low mood, I mean.
Okay. Okay. I would like to examine the hand for a tunnel sign and phalanx.
Excellent. Okay, there is positive tunnel test.
Okay. And just want to ask you, have you noticed any heartburn?
Heartburn, yes, I have 2 minutes left. I had, yes, doctor, and in the last month, I got what's called soreness in my stomach.
And you're not taking any medication for this, right?
They give me some medicine, but I stopped it. They give me for 2 weeks, then I stopped it.
On your own? Any specific reason for that?
No, though I feel myself okay.
Okay, so I would like to continue my examination by examining your chest. Any crepitation?
No crepitation, good.
Any murmur on the heart?
No.
GVP raised?
Yes, little bit GVB raised.
Okay, and now we'll examine the abdomen for any organomegaly.
1 minute left.
Hmm.
No need.
Okay, and the lower limb for any swelling or edema.
How you compare the how to do examination of the legs?
I will first. I want only to check for pitting edema.
Okay, no edema, or there is, yes, 1+ pitting edema.
Any joint? Can I ask you? Do you have any pain in your joints?
Excellent. Yes, I have some knee joint pain. Knee pain.
Okay, so I will examine the joint by feel
Okay,
and temperature
there
and
is crepitus. Yes, there is crepitus.
crepitus. Okay, only crepitus, no redness or swelling.
No redness or swelling. 30-second left.
Okay, so what is your main concern?
What I have, doctor, is it cancer?
So I appreciate your concern. Cancer is one of the differential because you have a positive family history of cancer, and also you have this headache, so we need to exclude it. But you might have a condition that affecting the gland in your brain, a condition called Mann syndrome. So which is a condition that affect many glands in your body, affect the gland in your head, and the gland in your stomach, and the gland in your neck. So I would like to run for you some investigation to exclude the cancer, and I will, and I will take from you some blood, and I will do imaging on your brain, and I will get back to you with all the result and discuss with you about your condition. That
Will,
okay?
will you admit me? I will add 1 more minute.
Okay.
Will you-
Yes, I would like to admit you to run for you all this investigation. Okay.
Any image, doctor?
Yes, I will do for you an image on your brain, and also we need to do for you a heart scanning, and maybe we can do for you a camera test for your stomach to check all these things, and I will come back to you with everything and discuss with
Okay.
you management plan.
Last concern, doctor.
Yes.
I have some difficulty in my intimacy. Is it related to this condition?
Yes, it could be related to that. That's why we need to know exactly and to start to give you the medication for that, because you might need also some medication or surgical intervention if you have a mass in your brain.
Okay, so I consider time is up. However, it was already up since 1 minute and a half.
Okay.
Yeah,
This
let's
patient
start.
has
Uh,
things. Okay. Okay.
yes. Tell me examiner time. So present your case.
So I examined this 50 years old gentleman who's presenting with chronic headache, with high blood pressure, newly diagnosed with high blood pressure. This headache is worsening on leaning forward and on cough increase, meaning that there is increase in intracranial pressure. He also feeling sick, and he started to have vision problem by bumping, and on examination, and also he was having snoring, and not fresh in the morning, so he might have obstructive sleep apnea. On examination, he was having bitemporal hemianopia. His examination was positive for bitemporal hemianopia, carpal tunnel syndrome. He's also complaining of dark tarry stool. Um, and also he was having joint pain and with crepitus, and he was having skin tag and maybe pigmentation in the back of his shoulder, maybe acanthosis nigricans. So putting this all together, this patient might have, and he was having gastritis, and I can feel also the mass in the thyroid gland. So putting this all together, this patient might have Mann syndrome, which because he has could include pituitary causes and pancreatic gastrinoma and parathyroid. So this is my
Perfect. What type of pain you know, or what type of pain this patient is having?
This patient have Mann type 1 mostly.
Mhm.
Um,
What's
yes,
your differential diagnosis?
I have different differential. It could be also it could be acromegaly, and he might have acromegaly uh,
Mhm.
due to pituitary adenoma, um, and um, and also gastrinoma, um, and he could be have a brain tumor, one of the differential also.
Okay, space occupying lesion. Okay.
So this is my differential.
Would you put obstructive sleep apnea in the differential?
Yes, and obstructive sleep apnea is one of the differential and one of the complication of acromegaly.
Yes. Okay. So men or isolated acromegaly.
Yes.
or even you can say any adenoma or non-functioning adenoma, but the difference will be in the non-functioning adenoma,
Yes.
the opposite of these signs and symptoms. So hypo. Okay.
Yes. Mm.
How to investigate this patient?
This patient, I would like to first investigation. First, I would like to do for him the routine blood, including full blood count, renal function, liver function. And I would like to do for him an MRI brain. I would like to do for him insulin.
Okay,
Insulin.
let's talk about blood investigation and radiology investigation.
Yes.
Make it two steps. Don't mix and put it together.
Okay. So the blood investigations, I would like to do the routine blood. I would like to the full blood count, renal function, and liver function. We'd like to do for him serum calcium, parathyroid, and thyroid, and all the hormonal profile for pituitary, including for the growth hormone. We need to do for him the insulin growth factor and oral glucose tolerance test, thyroid function test, TC, T4, and TSH, and we need to do morning cortisol and ECTH. We'll and I'll do for him serum gastrin.
X.
Yes.
X. What else?
And
What specific test for the diagnosis?
and parathyroid hormone, and I think gene test, red
Excellent.
oncogene.
No, the red for men too.
Men, okay, so men oncogene. No,
Yeah, just mention genetic testing, okay?
that's genetic test.
Okay, and now the radiology. What radiology you want to do?
Yes, first we'd like to do an MRI brain to check for pituitary adenoma. And I would like to do for him a chest X-ray first, and then an ECG and echo for cardiomyopathy. We'd like to do for him colonoscopy for colon cancer, and he might also need an X-ray on his knee.
Okay, why chest X-ray you choose to do?
First, this is the basics to exclude any mass or any anything, and to proceed with to exclude any pathological things because you're having shortness of breath. I don't know.
What do you think the short of breath in this patient?
I think could be related to the cardiomyopathy, cardiomegaly. Yes.
Okay, this is one of the causes. What other causes of short of breath in this patient?
Cardiomyopathy, it could be.
Okay, what's the cause of snoring in this patient?
Yes, the cause of snoring due to in the acromegaly itself, macroglossia, and yes.
Yeah, so airway obstruction.
Yes,
Obstruct sleep apnea.
Yes, yes, yes. It could be obstructive. Yes, due to airway.
Exactly. Yeah, airway obstruction due to macroglossia and obstruct sleep apnea. And this is the reason also of the awakening of over the night.
Okay.
Because of apnea.
Yes.
Yes, okay. What do you like to do, ECG and echo?
For cardiomyopathy and amyloidosis, cardiac amyloidosis.
No, it's not amyloidosis. It's due to what?
Because acromegaly can cause
You have two reasons.
can cause cardiomyopathy.
Yeah, by what cause or by what pathology?
Dilated cardiomyopathy. From also from hypertension itself.
Yes, this is the reason. So obstructive due to hypertension or hypertrophic, and the other one is cardiac output failure or high cardiac output failure due to growth hormone, overgrowth hormone.
Okay.
Okay. What else I want to do for him? Yeah, you mentioned the parathyroid level and the calcium bone profile, right?
Yes.
Gastrin, you said also. Yes, excellent. Okay, perfect, Dr. Sarah.
Thank
you. You reached to diagnosis, but I
and
will.
what cause of the crepitus? He has osteoarthritis or what?
Yeah, of the obesity or gaining weight, sometimes it's a cause of osteoarthritis.
Okay.
And the good thing you ask about, but this is always the complication of gaining weight in any patient, not only growth hormone or acromegaly. Cushing also can have this complication. Also, obstructive sleep apnea, also hypothyroidism. So hypothyroidism. And Cushing and acromegaly. Any patient gaining weight, he might have obstructive sleep apnea or osteoarthritis plus carpal tunnel syndrome. These are the three complications, and you have to do examination for each of them if you have time.
Mm.
This is the start, but I want to ask you what you missed here in the examination, and it
Mm,
will, yeah, it will minus your mark.
examination. I'm examined.
What's your case is about?
Um,
Acromegaly, right?
yes.
The main presentation.
The face I need for my
Yeah,
prognostic.
I'm sorry, I didn't share the page, the picture of the patient.
So yes, he might have a separation in the teeth. He must have
Exactly.
organ
Yes.
organ.
Yes.
Yes, all right. I remember, but I forget to ask about.
Yes. That's why we are practicing and we are training how to do and what to do. So
Yes,
in this patient, this is the picture of the patient. Whenever you will see the patient in the exam, it's spot diagnosis. But
yes,
the clue is not acromegaly. The clue is the association of acromegaly.
acromegaly. Yes,
Yeah. So whenever you find patient with acromegaly, you have to think why they bring this clear spot diagnosis patient. What do you think? So how acromegaly could present in the basis?
yes. It could present with visual disturbance, bumping in object
No, I mean as diagnosis.
from the
Not
teacher.
so. Let's talk about the complaint. Patient will come with, for example, in this patient, he came with headache, right?
Yes,
So they might present with headache,
yes.
either by the local cause of compression or pressure on the
And might have
surrounding,
obstructive.
by timber, yes, by timber hemanopia. This is as compression or as local cause. He might present with obstructive sleep apnea as complication, as you
Yes,
said.
yes,
He might present with carpal tunnel.
yes,
He might present with high blood pressure,
yes,
persistent hypertension. He might present with persistent hyperglycemia, diabetes. He might present with acidity as an association with min1, perforated, or sorry, duodenal ulcer, peptic ulcer due to hyperacidity.
yes.
He might present with heart failure and osteoarthritis at the end in the joint.
Yes, and one patient also, he didn't have features of acromegaly, but he was presented that his wife is complaining that he
Sorry.
pressed too much on the paddle while driving because he
Yeah.
big legs. So it was one of the complaints, and then the end he was having acromegaly. So he's pressing because his leg is big, so he's pressing too much on the paddle
Mm-hmm.
while driving.
Uh-huh, okay.
Mm.
Yes, of course, the main also possible presentation might be changing or enlarged hand or changing of the rings size or
Yes,
changing of the shoe size as you did.
yes,
So I guess a very important case in the exam at acromegaly, and it's not only acromegaly. You have to know what the clue and what's the hidden behind this presentation. Not only acromegaly, and you will be happy that I got the case from the face or from the presentation or whatever. No, you have to look for the complication and the association, and you did it at the end. So
mm,
take care. It's a training for how to access the other presentation and the other possible complication or association. That's why I brought this case for you.
yes, you're right.
Yeah, they are doing that nowadays. They are bringing cases with a lot of complication just to pick up the other finding and to examine the other finding. You have to do that. Not only the acromegaly features, you have to do the others.
Mm.
Okay, let's start from the system review. You did the analysis of the headache. And as usual, we are saying ask for the alarming signs to admit the patient. The alarming signs here was the pressure signs because of bitemporal hemanopia, increase in intracranial pressure because of high size macroadenoma. Mostly probably this patient have macroadenoma. So
Yes,
you will ask him this question to admit him. Whenever you have these signs of increased intracranial pressure or bitemporal hemanopia, this is alarming sign that he has macroadenoma and you will finish the question or the concern of admission. Yes, I will admit you. Okay. Then the other system related to the headache, you ask for the vision. How is the vision affection? Mostly by temporary myopia, and also the other presentation weakness or pins and needles, particularly the carpal tunnel syndrome. This is related to CNS. The next system, if you suspect either to go through system review or to go through the differential. Once you have acromegaly, suspect MEN1. Let's do it like this better. Don't go through system review. You might be lost in the system review without reaching to the association. So the most important here is the association of men. Finish it quickly, which are parathyroid and pituitary. What parathyroid, how he will present with hypercalcemia signs and symptoms, abdominal pain, low mood, or polyuria, polydipsia. So if you finish this issue, you will go to the pituitary. Any abdominal pain or any tummy pain, any acid brush or any acid, feeling acidity, or even any surgery before. He might have surgery for duodenal ulcer or endoscopy. Yes, exactly. So you have to ask this question also. Any surgery before or any procedure before? It might be hidden there. This is related to men. If you conclude there is men syndrome, men one, particularly men one syndrome, so you will feel comfort now. You can go through the complication of acromegaly, which are from up downward in the face. You can ask, as you said, you notice or anyone notice that your face looks or the facial feature looks bigger. Yes, doctor, my wife told me my nose is being bigger or my tongue, my lips. And you can ask for the neck, how you sleep, how is your sleep, sleep apnea. This is also one of the complications you have to ask about. Then from up, as I said, from up downwards, now you are going to the chest, or you can in the neck first. Any lump in the neck, if you suspect parathyroid adenoma. And that's why I said to you, there is lump in the neck. It's parathyroid adenoma. Okay. Then in the back, you can say, as you said, any skin or color change for acanthosis nigricans, or you can skip it to the examination. Okay, either to do it or to examine it, or to ask about it as a question in the history or to examine it. Okay, so when I say to you, I have yes darkening, you have to examine it. It's also one of the important things to examine. I will show you how to examine this. Okay. Then you will go to the heart, any heart racing, any chest pain. It's very important here. He might have also ischemic heart disease or heart failure. Any short of breath, apart from the one awaking you from sleep, which was obstructive sleep apnea. Then, as you said, the breast, any enlargement of the breast. This is important. Also, sometimes prolactinoma is associated. And the abdomen, you can ask about tummy pain if you didn't ask about gastroma before, but you have to say any tummy pain or any high acidity or any surgery before for gastroma. It's not only gastroma, by the way. You can have vipoma, the loose motion, but in this patient, he will have mostly constipation, either due to hypercalcemia or the increased growth hormone. It might lead to what the complication in the bowel. What yeah, colon cancer or polyposis. So you have to ask about the bowel motion, any change in the bowel habits, and any change in the water work quickly. For also polyuria, he might have also diabetes. Past medical history in the social. We finish the system review, the skin and the joint. The last thing, the joint. Okay, the family history is important. Yes, there is family history, men gene positive, so he might have, as you said, any cancer, any gland. Specify the question for the family history. It's very important. It's showing the examiner that you are asking about men by the name, men one. So you can ask either cancer or gland problem. Okay, this is for the family history, travel history. Okay, then the past medical history. Suppose you ask earlier any high blood pressure or any past medical history I should be aware of. You can specify question for hypertension and diabetes. And the medication you took, any allergy, any surgery, any procedure, any change in the intimate relationship, this is for the partner. He will have some of the change, either due to obstructive sleep apnea or due to the growth hormone, right?
Yes.
Okay. This is for the intimacy, but I don't think the question for HIV risk here is important, apart from the recreational drugs because of hypertension. Okay, then the occupation you ask already, and you immediately you have to stop driving. You stop him driving because it's harmful. He can't see the periphery. Then the smoking, alcohol, and quick, and the examination. So you start from the hand. You have acromegaly. Start from the hand as any patient. First, the general look. He will have overweight look, and the hand, you have to compare your hand to his hand. It's bigger than your hand. Okay, and you can examine for the sweating, skin tag at the back. So the dorsum for skin tag and the front or the palm for sweating. This is the signs of activity of acromegaly, by the way. Then you examine the pulse. The pulse, it might be high volume pulse, and you can do also the collapsing pulse because of high cardiac output failure. You might have high volume pulse. Okay, and the blood pressure, you offer blood pressure. You offer then paroxysmal myopathy sign in the arms. Then you have to examine the acanthosis nigricans in the shoulder at the back. Then you go to the face. You stand beside him and in front of him. In front of him, you can notice the large nose, the large lips and tongue. Can you protrude your tongue out? Then you stand beside him for the wide spaced teeth and prognathism. Okay. This is for the facial features, and you have to do it. This is acromegaly patient, so you have to do these things. The
Yes.
bite, the field you will have to do after acuity, and offer fundoscopy as you did. Then the tongue out, the circumference of the neck for obstructive sleep apnea. It might be increased.
And how
Uh,
you become schizophrenic?
you offer tape,
Ah, okay.
okay, offer it, but it's sure they will not have tape. Sometimes they have, but even if you can say it's maybe enlarged, no need to measure, or you can offer it. Whatever, this is not the most important, but the most important, the facial features, the hand and the blood pressure and the proximity. But you have to offer it for obstructive sleep apnea. Such patient having obstructive sleep apnea for two reasons: large tongue and airway, or large neck. Okay, but the neck also parathyroid swelling, the heart for heart failure. You can also examine for parasternal heave and pulmonary hypertension signs due to obstructive sleep apnea. The abdomen, offer abdominal examination for organomegaly, and don't miss the digital rectal examination for possibility of melena. He had history of melena and peptic ulcer. He might have also colonic cancer or polyposis. The neck for knee osteoarthritis, so you will feel crepitus. And the last thing, the size of the shoes, or the size of his feet compared to your feet, and the leg edema for heart failure. And that's it. Yes, it's a rich and very big scenario, but we have to train on these scenarios. They are not giving us one diagnosis cases only. They are giving us complicated cases nowadays. So you have to learn how to do quick history and quick examination target ones. Okay. Any question from you?
No, thank you. That's you have.
The file? Yes, the carpal tunnel. Perfect, Dr. Samah. You have to offer carpal tunnel. It's just you have pain here, yes or no. If he has offer, or ask the examiner for permission. If he doesn't have, offer tunnel test by tapping over it. Okay, you send the case. Okay. And so the investigation, as you said, there is general investigation, blood, and specific. The blood investigation, do whatever you are doing. Yes, electrolyte, anemia, CBC, coagulation, liver function, kidney function. And the specific test here is insulin-like growth factor 1. This is for screening, and oral glucose tolerance test for confirmation. How
Mm.
to investigate the image by MRI pituitary. And the main management here is, I didn't ask how to manage this patient.
Yes.
How to manage this patient?
Give medication زي as octeroid somatostatin analog.
Excellent.
We'll give also dopamine and antagonist, I think.
Agonist.
And the main surgery the definitive
Yes.
treatment is surgical transphenoid resection of the
Excellent.
and
And sometimes
radiation.
radiation. Excellent. And one medication you missed, what is?
We have growth hormone antagonist.
Yes, what's called? Big Visumant.
Big vision.
Big Visumant, yes. Yeah,
Yes.
perfect. So this is more than enough for the management of acromegaly. Plus screening, of course. Don't forget the screening and the investigation and counseling and so on. But I specify the pharmacological therapy or the best,
Cool. Yes.
the definite management is, as you said, surgical transphenoid.
Yes.
Yes, the surgical transphenoid removal of the pituitary.
Yes.
Okay. Okay. Mike, any question before we go? Big Visumant, yes. Big Visumant. Nerve conduction study for the complication. Yes, polysomnography for obstructive sleep apnea. It's a big case, and either they will go through the acromegaly or the complication according what you drive or how you drive the case. If you start to talk about the complication, they will ask you about the complication. If you give him the clue about the acromegaly, he will ask you about the acromegaly investigation and management. So it's up to you. And sometimes up to him. He will be the leader for the question. He will be the one started with the question, and you will be the one answering him. But don't say something you are not sure about. He might go in details with this, and you might be in troubles. Okay. Let's go to the next slide if no one has question. Hoarseness of voice. You are the doctor in the general medical clinic. Mrs. Kathy Donnell, referred to you by GP. Please read with the consultation. Mrs. Kathy Donnell, aged 49, has complained of hoarseness of voice for 6 months. She smokes 15 cigarettes a day, and after a bout of winter bronchitis 2 years ago, she was started on beclomethasone and salbutamol inhaler. She is also known to have esophageal reflux, for which she takes a maintenance dose of lansoprazole. She has no other past medical history and takes other medication. Please see and advise. Okay, just give me 1 minute to prepare. Okay, let's start.
Okay.
Hello, I am Dr. Mukhtar, the doctor in the clinic today. You must be Kathy Donnell.
Yes, doctor.
You are 49 years.
Yes.
How can I call you today?
Cassie.
Kathy.
Yes.
Okay. We are here to discuss about your health issue. Is that okay for you?
Yes, please.
Okay, can you tell me more about your complaint, what you have exactly?
Yes, doctor. I started my voice as you can hear me. It's little. I have hoarseness in my voice. This is. This is started. I think I noticed 6 months ago that my voice started to be croaky, and 4 weeks ago, as you see, my voice is very hoarse, and this is bothering me a lot. That's why I came to you today.
I'm so sorry for your suffer and to hear about that, Mrs. Kathy.
Yes.
Can I ask you more about this? You told me 6 weeks ago or 6 months ago started,
No,
right?
I noticed that there's change in my voice 6 months ago, but 4 weeks ago it started to be more hoarse
Worse.
and more
Okay.
as you hearing me like this.
Yeah, I'm so sorry again about that.
Hmm.
Okay, any previous attack of this, or this is the first time? I mean, the
No,
6 months back?
no, this is the first time I have these issues.
Okay. And I'll ask you some more questions,
Yes,
if you
please.
don't mind.
No problem.
Okay. Along with this, you have any other complaint?
No, I don't have
No,
any
so
complaint.
nothing. Okay. You have any short of breath?
No, I don't have short of breath now. No.
Okay. Regarding to the last infection, what's called bronchitis, right?
Yes, yes. I was having this infection 2 years ago, and at this time I was having I was having phlegm, which was colored phlegm greenish, and I started to have wheezy chest, and I had blood in my sputum one day, my phlegm, and then the GP did for me a chest X-ray, which was normal at this time. And since that time, I'm still having this cough, but it's slightly with some mucoid secretion.
Okay. You have any other infection in your body?
No, I don't have. Only 2 years ago.
And it was seasonal due to exposure to some pollens.
As you told me, this is chest infection, and since then,
So it's okay, occasional only, nothing significant.
no. But the GP gave me also because I'm still have some wheeze in the morning. He gave me this brown inhaler
Mhm.
and also a blue inhaler.
Okay. Are you diagnosed with asthma?
I think the GP diagnosed me with asthma because I was having this wheeze, and also it was more in the morning, and I was having cough, which is persistent with me. So he diagnosed me with asthma, and he gave me this two pump.
Okay. And you do the test for asthma, the blue test, the blue
He
wing
did.
test.
He did it with me at the beginning, but I didn't. I'm not
So you
doing.
are diagnosed with asthma as
Yes,
definite
I think
diagnosis.
so. I think so. Yes.
Okay. And you have any cat or pet at home?
No. Yes, I have a cat, but this she has it. I have it with me since long time.
Okay. And he told you this is asthma. It's not something related to the exposure to your pet.
No, no, no.
Okay. You told me about this medicine. Can you tell me more about it? How you can take it? Are you compliant with it?
Yes, I'm compliant. I'm taking the inhaler, uh,
Mm-hmm.
both of them. But recently I started because I'm feeling my chest is more wheezy. So the GP told me to have it. I can have it more. So I think the brown inhaler I'm taking it more frequently now.
Okay. And you know how to use it? They teach you how to use
Yes,
it?
yes, yes. I as a nurse in charge, she had to explain it for me and she checked it with me, and that I'm using it right.
So you are using spacer?
No, I'm not using space.
Did you do wash of the mouth after you finish?
No,
You are not. Okay. Anyone told you to do that? after you finish especially the brown one?
I'm not quite sure, but I think the doctor told me. But when you are saying now, I remember that I should do that. That's why I need.
Yeah, okay. So for the future, we will tell you about that at the end.
Okay.
Okay. So you have any other short of breath
No,
and the cough now? You have any cough
I'm still having some cough. Yes.
and any production or any
Yes, with some
phlegm,
white phlegm.
white phlegm?
It's more at night.
Okay. You have any chest pain?
No chest pain.
Any awareness of your heartbeat?
No,
Any weather preferences?
no,
Okay. And any headache?
no,
Any vision problem?
no,
Any lump in front of your neck?
no. I didn't notice.
Any tummy pain?
No, I don't have tummy pain.
Any change of your bowel habit?
No change in my bowel habit.
Any change of water work?
No,
Any joint pain?
no,
Any skin rash?
no,
Did you gain weight recently?
no,
Any change of your appetite?
no,
Any high body temperature?
no, no,
Any lumps or bumps?
no, no,
Okay. Any sore throat recently or infection apart from the one you told me about?
no. I didn't have. Only 2 years ago.
Okay. Any other condition you are diagnosed with apart from asthma?
Yes, I have gas flux.
Uh-huh. Okay. And you are feeling now is still taste in the mouth?
I'm still working at night sometimes with having some acidity in my mouth. But I
Did,
start to when I proper sleep on sleep pillow, it's helping me not having this acidity.
and did you take any medication for it?
Yes, the doctor gave me lansoprazole.
And still you are compliant on?
Yes, I'm taking it.
So is it getting better?
I'm not quite sure. I think it is the same. It's not
The same.
yes.
Okay. Any others medication? Sorry, any other condition you are diagnosed with apart from asthma and acidity
No,
or
no,
GERD? Okay. Any
no,
medication apart from the one you told me about?
no. Only this inhaler, this pump.
Any surgery before?
No, sir.
Any allergy to any medication?
No,
Okay. Any family history of same condition?
no,
Any travel recently?
no.
You have a partner?
Yes, I'm living with my husband.
Sorry for this question. You have any problem with your period or any change in your period?
No,
Okay. Did you notice any stretch mark in your skin?
no,
Any bruises?
no.
Mm. Okay. Do you smoke?
Yes, I'm smoking.
How many cigarettes per day?
I'm smoking 15 cigarettes per day in the last 12 years.
Yes, it's so I can say it's very dangerous to smoke with your condition. It might be related also to your diagnosis. So I can advise you and strongly to stop your smoking. If you need some help, we can refer you to smoke cessation clinic.
Okay, I'll see that and I'll let you know.
Okay. Do you drink alcohol?
Yes, I'm drinking because I'm working as a barmaid. So I'm drinking 3 pints every day.
So are you exceeding the limit?
Might be. Yes.
So can you moderate your intake, please? It might also be related and it might harm you.
Okay, I'll try. But it's difficult when you are working such a job.
Yeah, we can help you, or you can change your position in your job, or you can change it at all if you are willing to be quitting from this.
I think it's difficult, but let me try on my own and then I will see what I can.
Did you have any bench drink?
No binging.
Okay, so you are not opening in the morning, drinking while you are open your eyes when you awake.
No, 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 not like this. No.
Okay. You told me about your job. Okay, can I examine you now?
Yes, please.
And remind me, please, when 2 minutes left. Okay.
Mm.
Okay, so I will start by the general look. Does she look cachectic or any
No, nothing.
nothing? Okay, so I will start by the gland in the I mean in the neck, local
Mm,
examination of the neck, inspection, any scar, any
nothing.
thyroid swelling,
No.
no goiter. So I will ask her to drink sip of water.
Mm.
And I can notice also the thyroid gland, any change or any movement.
Normal.
So normal. Okay. And any lymph node in the neck?
No.
Nothing. I will examine the mouth and the back of the mouth, any sore throat or uh, any ulcer in the mouth,
No.
any candidiasis in the back of the tongue.
No.
Nothing. Okay. I will examine the hand now for any stretch mark or bruises in the skin.
Nothing.
She doesn't have any carcinoid features, right? Any
No.
fat in her mouth, in her face, or
No.
interscapular? Nothing. I will
No.
offer the blood pressure sitting and standing, or other vitals,
Normal.
or are normal. Okay, the blood sugar,
Blood sugar is normal.
temperature.
Normal.
Okay, I will examine the face, any pallor or any jaundice,
Nothing.
nothing. And the chest now. I will examine the chest for inspection, palpation. First, by inspection, any change in the tracheal side deviation,
No.
nothing. So I will ask for expansion. Any change in
No.
expansion?
No.
I will now percuss any hyperresonance.
No.
I will auscultate finally the wheezes, any expiratory
Mild,
wheezes.
mild expiratory users.
Okay, I will ask to examine for pulmonary hypertension signs, loud P2 or parasternal heave,
No.
nothing. Okay, I will examine now the abdomen, especially the epigastric area for GERD, any abdominal pain, any tenderness, I mean,
No.
nothing.
No.
Okay, any lymph node in the axilla,
No.
any leg swelling.
No legs swelling.
Okay, Mrs. Kathy, I will summarize what you told me about, and if you want to add anything, you please let me know. So you have been diagnosed with asthma, and you started on some inhaler, the brown one and the blue one, and you are compliant to them, but you are not taking with a spacer, and you missed also washing your mouth after finishing the brown one.
Yes.
Your asthma recently not controlled well,
Mm.
and you have also GERD, and you are taking lansoprazole for it. You are working in the bar, and you are drinking alcohol. You are a smoker as well, and around 15 for the last 12 years. You want to add anything?
No.
May I know what are your concerns?
Yes, my concern, did I have cancer? Because I read about this hoarseness could be related to cancer in the gland in front of the neck. 2 minutes.
I appreciate your worry and your concern, Mrs. Kathy. Actually, cancer here is in the bottom of my list, but it's still there because you are smoking a lot. And smoking one of the risk factor of cancer in any patient. However, you don't have the signs of cancer like losing weight or any lumps or bumps in your body or high body temperature or night sweats. But still, we will work on that, and we will do some blood tests and some imaging to reach the diagnosis and to exclude others. You have any other concern?
No, so what you will do for me?
Yeah, we will arrange a clinic appointment with the chest doctor, and we can do some tests, blood tests, to rule out any infection and to see if you have any ongoing infection. Confirmation of your asthma also, and we can do some imaging to your chest to rule out infection. And finally, we can call the nose and mouth doctor. He can have a look to your back of your mouth and to the area of your phonation or your voice, I mean. And we will be back to you in another appointment to tell you about the finding and the confirmatory test, sorry, a confirmatory diagnosis, and to tell you about the other diagnosis.
Okay.
You have any other concern?
No, no, I don't know.
So recently, I can advise you to stop smoking. As I said, it's one of the risk factor for cancer. And I will refer you to the nurse,
Time.
specialized nurse, to teach you how to use the spacer. Okay, time's up.
Yes. Okay. So present your case.
Yes, Miss Kathy, 49 years. She is she came with a complaint of force into face, started 6 months back. Then it was the last 4 weeks. She had a history of chest infection before, and after that, she was diagnosed with bronchial asthma. Started on 2 inhalers, steroid and beta blocker.
Mm.
She is compliant to them, and she started to use them more frequently recently. However, she is not using spacer, or she is also not doing gargling after finishing the steroid inhaler,
Mm.
for which it's she's having a risk to have uh, hoarseness of voice due to this local steroid or topical steroid. So it might be this the cause here. It's induced or iatrogenic due to the steroid inhaler or inhaler of steroid. She had history of, yeah, she's smoking and heavily smoking, and she's drinking alcohol as well. She had also GERD. This GERD might be the trigger for her asthma, or might be also uncontrolled asthma due to the misuse of the inhaler.
Okay. So what is your differential?
Yes, my differential I wrote in my paper. It might be injury to the nerve. However, she doesn't have any surgery before, and no thyroid problem before. I wrote also it might be drug induced or related to inhaler. I wrote as well for possibility of cancer, laryngeal cancer. And here the risk is there. However, she doesn't have any signs of cancer. Since she is the smoker, I still think about it.
Okay, and you said that there could be just steroids. What is steroid? How is the steroid will cause hoarseness of voice?
Yes, by the edema and swelling in the vocal cord.
Okay, and no other causes that the steroid can?
Yes, it can cause candidiasis.
Yes. Okay. And okay, and what investigation you will do for this patient, and what's your management plan?
Yes, the investigation will be baseline basic investigation, blood work up, just to rule out any infection, CBC for anemia, or also for inflammatory markers. Apart from this, renal function, kidney function, just as baseline, it's non-related. However, we can do it as baseline. We can do also investigation by imaging. We can do chest X-ray to rule out infection as well in the chest. Apart from this, the specific test here will be laryngoscopy by ENT to confirm the diagnosis.
Okay, and what treatment or advice you will give to this patient?
Yes, after referring here to multidisciplinary team approach, including the pulmonologist to control her asthma first, and specialized nurse had to teach her how to use this inhaler perfectly and properly. And also ENT doctor also will be involved here to help for diagnosis and to rule out candidiasis, which might be dangerous here and should be managed if she has any candidiasis. Apart from this, counseling, education about smoking, and also alcohol drinker to be moderate intake. The most important here, the specialized nurse to teach here again about the use of inhaler in proper way, and the gargling after finishing the steroids inhaler.
Okay. Yeah. So, okay. I don't have other questions.
Okay,
30
still
seconds.
20
You can
seconds.
ask yourself one question.
Okay. What we can add here as a question?
I think it's only 8 seconds. So,
Okay, so it's yeah, time is up. Let's comment.
so
You can start
you
commenting.
did
Yes.
Massive
Huh?
diagnosis.
Sorry?
What is your diagnosis?
Yes, it's steroid induced.
okay.
Steroids can cause hoarseness.
Yes, this is one of the cause.
ومشيت مع بانكوست عديل.
Bancost? No, it's not related to Bancost.
Okay.
Anyway, you have to ask about cancer sign in this patient.
Okay, so you did it very well, Dr. Bassem, but you should ask this patient has hoarseness of voice. One of the questions that you can ask that any misuse or overuse of her voice, she might have this hoarseness because she's
Yeah,
overusing.
this is one of
So this one that you missed. You ask about all the causes, and also you can ask about any swelling in your arms, any flushing in your face for pancreas tumor. You might ask this question. So you did it well, and the management was well. The only differential diagnosis, yes, the first differential, it could be this hoarseness due to corticosteroid inhaler and candidal infection due to steroid. She might have candidiasis. This is the first differential. The second one, because she having GERD, so it could be related to the GERD, gastroesophageal reflux, can cause this hoarseness from the acidity. That's why she can have it. And then you said that it could be maybe laryngeal polyp, carcinoma, and it could be vocal cord paralysis secondary to lung cancer because this patient is a smoker also, and hypothyroidism as you checked. Okay. And when you're examining, I think it's better also to do a retrosternal percussion for the goiter. Okay. Is retrosternal percussion the result? Yes. Okay. This only you can do it because this is could be because he has a goiter and cause the hoarseness, so we make it external dullness. Okay, you check, you say everything about the investigation. You said X-ray chest, right?
Yes.
Yes. Okay, chest X-ray and ENT doctor, as you say, with laryngoscopy. And yes, the patient, you did very well by asking the patient about gargling, about use the spacer, because can decrease the risk of exposure to, because when she has the spacer, all the inhaler will go to the lung, not to the mouth, and decrease also the risk of having candidal infection and the gargling also itself. So we did it very well by asking these two questions, and you should address them in the management with the patient. And yes, for the asthma, yes, you did it. You said that you will also need to manage her asthma. So this is a differential. The first thing is due to the steroid inhaler, and second thing due to GERD. She has two things. And the last one on the differential, as you said, that could be lung cancer and can cause vocal cord paralysis or pancreas tumor. You did it well. You covered everything. Only very small things that you missed. But the important one, the worst overuse.
Yes.
Yes.
This is as functional.
Yes.
And I guess it was a clue in other scenarios like singer.
Yes.
Yeah, it was in communication scenario as well. One of the patient was singer, and she had this hoarseness of voice due to the use of steroid, and she's not using spacer. And the clue was to use the spacer to help her to avoid the hoarseness of voice because this is her job.
Yes.
Yeah. Okay. Thank you, Dr.
Only
Sir.
smoking and alcohol can increase it, but it's not.
Yeah.
Yes. So you address all of the things. So you did it very well.
Okay. Thank you, Dr. Sarah. A very nice case and a very nice also presentation and the information also you said.
So thank you.
Thank you too. Any question from others? Any added comments?
Will you do CT chest for this patient?
We can, yes, I think.
Yes, if you suspect a cancer, you can add yes.
And
Just
definitely,
a small comment.
Yes.
Yeah,
Yes.
when the patient gets in the answer the concern, usually better to tell the patient what your differential. Yeah, and then you can tell the examiner because you tell the examiner that the first differential you have because of the drug. But you in the when she answer her, she tell you what is wrong with me. You didn't tell her the cause of the exact the cause of her Hoarseness by Helsinki. You missed to tell her. Just remember just that this point, small point. Otherwise, I did very well. Actually, excellent, Dr. Bas.
Okay, thank you, Dr. Ahmed. Thank you so much. So you mean the misuse of the drug, right? You want to say it's related to the misuse, to be clear about this.
The main complaint to Hoarseness voice, just you need to know what's the wrong, what's the cause
Yeah.
of her voice. Just better to tell the patient what you tell the examiner first. Same.
Yes, yes. Agree. Okay, thank you, Dr. Ahmed. Any other comment? Thank you, Dr. Ahmed. Yes, for the CT, if you suspect a mass or you suspect retrosternal extension, you can do it. You can add it, but definitely you can start by chest X-ray. Whenever you did X-ray and you find some of the suspicious of shadowing, you can proceed for CT. But it's not the initial tool to do it in the imaging. Always you are starting by chest X-ray. In any chest or any case, including complaint related to the short of breath, you have to start with X-ray. Whenever it is not also the most diagnostic one, but still you have to start with it. They are trying to limitate or to make limitation to the advanced image with no need or unnecessary imaging, like CT. They want to reduce the exposure. I guess this is in UK, but here, yeah, in the Gulf, we are doing everything, but we are always starting by chest X-ray, by the way. It's not, it's like ABC. So we start by chest X-ray. Then if you suspect something, you can go for the X-ray. Even with the PE, you suspect PE, you start with chest X-ray. Then later on, you can proceed for CT pulmonary angio. Okay.
Only the other things I forget to say, it's also there's some neurological condition associated with hoarseness when they have a stroke that affecting the muscle of the larynx or Parkinson's disease.
Yes.
Keep it, but you ask about these things.
Yes, it will be more in the elderly patient
Yes.
with neurological deficit, as you said. Yes.
Yes.
Okay. Anyone else you want to add any comment? Hello. Okay. Dr. Samah, tumor till prove otherwise. Tumor when you have loss of weight or constitutional symptom or B symptoms positive, you can put it in the top. But since she is not having these symptoms, you can put it, but not in the top. Yeah, cancer might be present with the same presentation, but mainly he will have or she will have some of the constitutional symptoms: loss of weight, loss of appetite, night sweat, night fever, lumps or bumps, lymph node in the examination. So you can add it or you can put it in the top. While it's negative in the history, you can say, yes, I can guess about it or I can suspect it, but I will not put it in the top. Okay. Differential, yes, we mentioned it, the misuse of the inhaler, GERD itself, or cancer. For me, because so bad in the different. No, it's not like that, Dr. Samah. We are learning. No, with the time you will know. You will know. You will practice this case with some mentors or with some participant or with colleague. Then you will know it, and you will hear the differential. Then you will fix this, and you will know this is the differential for the patient with hoarseness voice. No one born professional. You have to learn with the time. Okay. So Dr. Sarah brought for us a new case here, which is, as usual, she bring the different cases and unique, as I can say, and very
I
rare
don't know
case.
the straight cases.
Sorry?
I don't know the straight cases. I fail because I don't know the straight cases.
Steroid?
Only the
What?
weird cases.
The exam?
Yeah, yes. I don't know the straight cases. I'm not good in the straight cases. I
No, no. I
swear.
give to you today straight case, right? But
Yes.
be sure the straight case come with some clues or with some hidden agenda.
Yes.
Straight cases, it's not a straight cases only. They have to put something associated or complicated with this straight cases. So it's be sure whenever you have straight, there is something hidden.
Yes.
It's
alright.
tricky. It's tricky. Definitely, it will be tricky. But the tricky cases
Mm.
and the diagnosis will be easy to get, and if you reach or approach well, you can give you the mark. But the straight cases, if you didn't ask for the association or complication, they will minus you. This is the difference between tricky and straight. Straight, you have to search for the other association. The tricky, you will reach it maybe
The
at the
diagnosis.
end. Maybe you will reach at maybe the second, the last second. Imagine
Yes,
like
yeah.
like today's scenario. I add for you at the comment only or the concern that I have some acidity. So you ask about the gastrinoma, right?
Yes, yes.
And it will be the clue for the scenario, men. But
Yes.
now onward, you will not forget that whenever you have acromegaly or any pituitary adenoma, you have to think about min one in the top before going through the other association. Min one in the basis wise, very high yield topic.
Yes.
Okay, like autoimmune polyglandular syndrome with Addison. It's the same association and the same famous cases in the exam, okay? Any other, yeah, thank you, Dr. Thank you so much for this. Anyone else has comments? Any question?
Mm.
No more question? Okay. You want to add anything, Dr. Sarah?
No, thank you.
I guess Dr. Azhar is absent, so
Mm.
yeah, he's not with us in the meeting. Please feel free to add any comment to get more confidence, not just writing. You can add by sharing. We can hear you, no problem. By the way, I started this meeting by listening, then I shared an information. After that, I share daily, then I practice, and so on. It's like this. You can start by this. But since you are listening only, you will never participate. So please try to share with us verbally, to comment, and you can also participate. It's open for all. Okay, if no more question, let's end the session. We'll see you tomorrow, inshallah, with communication day. Thank you all. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.